Acute hand ischemia refers to the sudden reduction of blood flow to the hand, which can lead to tissue necrosis if not addressed quickly. The urgency of the situation arises from the limited time available to restore blood supply before irreversible damage occurs, typically around 6 hours after the onset of ischemia. Anatomy. Brachial artery. This is the main artery of the upper arm that bifurcates into the radial and ulnar arteries at the elbow. Radial artery. This artery runs along the radial side, thumb side, of the forearm and supplies blood to the lateral aspect of the hand, ulnar artery. This artery runs along the ulnar side, little finger side, and primarily supplies the medial aspect of the hand. Causes of acute hand ischemia. 1. Embolism. Often originates from the heart, e.g., atrial fibrillation or large vessels, leading to obstruction in the peripheral arteries. 2. Thrombosis. Can occur in patients with atherosclerotic disease or hypercoagulable states where a clot forms at the site of an existing narrowing. Vascular injury. Trauma from accidents. Fractures or penetrating injuries can disrupt blood flow. 4. Vasospasm. Conditions such as Raynaud's phenomenon can cause temporary constriction of the blood vessels, leading to ischemia by compression. Tumors, hematomas, or tight bandages can compress arteries and restrict blood flow. Symptoms of acute hand ischemia: pain, sudden and severe pain, often described as throbbing or aching. To pallor. The hand may appear pale or white due to lack of blood flow. Coldness. Affected hand may feel cooler than the opposite hand. Numbness, tingling. Patients may experience sensory changes, including paresthesia. Weakness. Difficulty moving fingers or gripping objects. Necrosis. If ischemia persists, the skin may develop blisters and eventually necrosis. Surgical treatment. When conservative measures fail or in the presence of severe ischemia, surgical intervention is necessary. The steps include preparation. The patient is typically placed under general anesthesia or regional anesthesia, depending on the situation. 2. Exploration of the brachial artery. A longitudinal incision is made along the medial side of the arm. To expose the brachial artery, surgeons assess the artery for any thrombus or embolus and may perform thrombectomy if a clot is present. 3. Assessment of radial and ulnar arteries. Exploration may extend to these arteries if ischemia is suspected in their territories. The surgeon looks for signs of injury, thrombosis, or embolism. 4. Embolectomy with Fogarty balloon. A Fogarty catheter is used for embolectomy. It is a specialized catheter with a balloon that can be inflated and deflated. The catheter is introduced past the site of occlusion. The balloon is inflated, and as it is pulled back, it removes the clot or embolus. Acute hand ischemia, comprehensive overview.